an FYI.
Okay, thank you.
Thank you. Good morning, everyone. Welcome to our webinar. We've got about half of our pre-registered participants have joined us so far, but we're going to get started. We did completely sell out. We have a capacity of 100, and we did sell out with pre-registration. So thank you to everyone for your interest today. I'm going to ask our panelists to put their cameras on so that we can see you on screen. And I'm going to start out with a brief introduction. My name's Shelley Fellows. I am the chair of Automate Canada. I'm joined right next to me on my screen anyway. I'm joined by my colleague Mike Belden, who is the chair of CAM, the Canadian Association of Mold Makers. We are really delighted to offer this webinar today, Health and Safety for Manufacturing. It's going to be a fascinating hour and a half. So we've got 90 minutes here to be able to get in the material along with a good question and answer period at the end of this session. We know, based on the feedback that we've had from the COVID-19 impact survey that we launched so many weeks ago in mid-March, we know that manufacturers are very concerned by health and safety in their workplaces. Many companies are back to work now, back up to full operations, and are looking for more information for how to structure things appropriately in their workplace. And so our team today clearly offers information that is of interest. Again, we were sold out, so we hit our capacity. And just so you know, we are recording today's session. We will have it available after. We'll send out link to our YouTube channels so that you can share it with your colleagues who perhaps weren't able to register for today's session. Thank you very much for choosing to spend time with us. So we have an excellent panel of experts. Kim Litchfield is here. She's the regional manager with WSIB. We've got Ron Landry, the acting provincial coordinator with the Industrial Health and Safety Program with the Ministry of Labor, Training and Skills Development. And then we have Melissa Brown, who is the manager stakeholder relations with WSIB. I think I would be remiss if I didn't say thank you and express our gratitude to Nancy Creighton, who many of us know. She's a senior business advisor with the Ministry of Economic Development, Job Creation and Trade. She's worked very closely with us to make today's event possible. And someone who's wasn't able to join us, but who put a lot of effort behind the scenes for coordinating is Diana Rea from WSIB. We have so much appreciation for them and the work that they've done. So thank you very much, Nancy, and someone please pass along our thanks to Diana. You can see from our agenda that we've got a lot to cover. Melissa, Kim, and Ron have a lot of material for us, but we've allowed for 30 minutes at the end of today's session for questions and answers. How we're going to do it is we've asked our panelists to prepare presentations, so they're going to walk us through the information they have for us. As you have questions, please post them to the chat. Post them to the panelists. And if you go to the chat function right now, you'll see some information. You'll also see the detailed biographies on our panelists. When you submit your questions via chat to panelists, they will be seen just by us. So that will preserve your anonymity. And Mike Bilton and I will be moderating the questions at the end of the session. Before we begin, before I turn it over to our first speaker, who will be Ron Landry, I'd like to do an acknowledgement that while we're in virtual space with a webinar, my seat is here in Essex County. I'm based in Essex County. And so on behalf of those of us in Windsor, Essex, we'd like to acknowledge the presence of the Three Fires Confederacy peoples in our region, the Ojibwa, the Ottawa, the Potawatomi, and the Huron-Wendat, as well as the Caldwell First Nations. So with that, I'd like to turn it over to Ron.
All right, thank you, Shelley. Can you hear me fine?
Mm-hmm.
All right. So yeah, I'm Ron Landry. I'm the acting provincial coordinator for the Industrial Health and Safety Program with the Occupational Health and Safety branch of the Ministry of Labor, Training and Skills Development. And yes, that's a whole lot of information to put on the business card. So I'm going to run you through the presentation. Just get it set up here. I guess you'll be advancing the slides for me then? We can start the slideshow. You don't have control.
Hey Ron, it's Mike. If you'd like, please go ahead and start off on the slides, and I think Carly can facilitate flipping the slides or retarding them as you need to.
So we just need to get to the start of the slideshow because I don't have control of it.
Carly, if you could slide up to the view menu and click presentation mode.
Am I not in presentation mode? Does nobody see that?
Or reading mode, I apologize.
We don't see that, Carly.
One moment, please. Does we see this now?
No.
Yep, so scroll up to the very top of right above the presentation page, and you'll see view. Click on that, and there'll be a menu that pops up, and you can click on reading mode.
Yeah, I'm seeing reading mode, but I guess you're not seeing it. Do you see it now?
Yes.
Yes. Okay, so I think we're good to go. So we can go to the next slide. So this resource is the Occupational Health and Safety Act and its regulations, and should not be used as or considered legal advice. Health and safety inspectors apply the law based on the facts in the workplace. It is the responsibility of workplace parties to ensure compliance with the legislation, and so this document again does not constitute legal advice. We can go to the next slide. So some of the things I'm going to cover, I'm going to outline some of the risks associated with COVID-19, explain the requirements on the Occupational Health and Safety Act and its regulations. I'll share an overview of our field visit COVID-19 related activities, highlight some of the practices for protecting against COVID in the workplace, some information on what to do if a worker tests positive, and also to provide information resources available to assist workplace parties. Next slide, please. So as we know, the COVID-19 causes a respiratory infection believed to originate in Wuhan, China, which has expanded into Canada and virtually every other country around the world. The virus typically spreads through close personal contact with an infected person or touching an infected surface and then touching your mouth, nose, or eyes. Next slide. So during this time, with emergency orders in effect, the Ministry of Labor inspectors continue to enforce the Act and its regulations, including but not limited to the Occupational Health and Safety Act and the Industrial Establishments Regulation. Our inspectors also have authority to enforce emergency orders made under the Emergency Management and Civil Protection Act. We don't enforce everything in there, but we've been given authority to enforce specific sections of that act. Next slide, please. So we've been doing proactive inspections. So these are unannounced inspections where we just show up and go through the internal responsibility system, obviously with a focus on COVID-19 precautions. Reactive investigations, work refusals, critical injuries, fatalities, and occupational illness and disease reports, and issues dealing with reprisal. We've also been doing consultation field visits where we are reaching out to workplace parties, providing education and compliance assistance, and a lot of links to a lot of the resources that we have available on our website, as well as health and safety associations. We also have a team of specialists that may accompany inspectors to provide additional expertise, such as ergonomists, engineers, occupational hygienists, doctors, and radiation experts. We have also been conducting some joint visits with local public health, for example, following up on occupational illness outbreaks. Next slide, please. So as of mid-June, we've conducted over 10,000 field visits, approximately 4,800 proactives and 5,400 reactive. So again, reactive is where we're responding to a report of some sort. There's been over 6,400 orders issued under the Act and its regulations. Inspectors, employment standards officers, and TSSA inspectors have been conducting proactive visits to workplace to support the ministry's role under the Emergency Management and Civil Protections Act. So we've been using some of these other resources to help reach out to workplace parties, providing compliance assistance and additional resource information that we have available. Next slide, please. So currently, we're relying on the 25(2)(h) duties under the Occupational Health and Safety Act to take every precaution reasonable circumstance. As you know, there's no COVID-19 section in the Act or its regulations, so that's why we're relying on this general duty clause, which includes focusing on screening to prevent workers who may have COVID from coming to work, physical distancing, the 2 meter separation between workers or others, proper on-site hygiene, engineering controls, and other precautions, including the use of personal protective equipment. So as we know, personal protective equipment is the last line of defense. In the hierarchy of controls, you're basically trying every other avenue, including engineering, shielding, things of that nature, before you get the personal protective equipment on a worker. It is the last line of defense. Next slide, please. So employers and workers need to consider how they can work safely and prevent the spread of COVID. All measures taken to prevent the spread of COVID should be done in compliance with the requirements of the Occupational Health and Safety Act, emergency orders made under the Emergency Management and Civil Protection Act, and public health directives and guidance issued by Ontario's Chief Medical Officer of Health and the Ministry of Health. And there's links throughout this document that will take you to those locations. And my understanding is that a copy of the presentation will be provided following today's presentation. Next slide, please. So screen to prevent workers who may have COVID from coming to work. So symptoms include cough, fever, and difficulty breathing. Provision of hygiene supplies, soap and water, or hand sanitizer. It's important to note that hand sanitizer works, but if your hands are heavily soiled, it's not going to work. So if you have heavy soiled hands, you should be washing your hands with soap and water first, then hand sanitizer for it to be effective. And cleaning and disinfecting of high-touch surfaces, shared tools, controls, handrails, doors, and lunch tables as an example. Next slide, please. So on the 2 meter separation between workers where possible, consider changing the work layout, work schedule, or job rotation to allow distance to start and end of work and during lunch and other breaks. Consider limiting the number of entry points and using floor markings to show where people should move and how they should distance themselves. And control measures including robust screening, hand hygiene, cough, sneeze etiquette, and frequent cleaning of high-touch surfaces are even more important. Next slide, please. So in circumstances where 2 meters cannot be maintained, the employer must implement additional controls to protect the worker. In the hierarchy of controls, the last line of defense is personal protective equipment. If workers are required to wear PPE, workers must be trained in its use, including proper removal and disposal, care, and limitations. Masks used for source control are not considered to be PPE. So that would be your cloth masks, your homemade masks, things of that nature. Non-medical rated mask is what we're speaking of there, is source control not being considered to be PPE, because what it's doing is it's protecting that individual from spreading anything that's not protecting that individual, which is what PPE typically does. And employers may wish to consider implementing masks for source control as part of the suite of controls in place for COVID. For guidance on source control and masking, we have a link to the Public Health Ontario Masking for Source Control of COVID and considerations for workers in non-healthcare settings. Next slide, please. So under the Occupational Health and Safety Act, Section 52(2), if an employer is advised that a worker has an occupational illness due to an exposure at the workplace, or that a claim has been filed with the WSIB, the employer is required to notify the Ministry of Labour in writing within 4 days. You can refer to the Industrial Regulations, Section 5, for the details of what that report should contain. So it's important to keep in mind here that there's actually 2 sections, right? So the first part is, if you have a worker test positive due to an exposure at the workplace, and some people get hung up on, well, how do I determine exactly where they got it from with community spread? So there's really hard to get a definitive answer on that. The second part is, if a worker has made an occupational illness claim, then the notification requirement kicks in as well. So without getting too hung up on testing or trying to determine exactly where they got it from, if they put in a claim, then you need to notify us. And the notification can be done through the number provided at the bottom of the screen, 1-877-202-0008. Next slide, please. So it's important to consider, as we're heading into the summer months, heat stress. So we're implementing controls to address exposure to COVID-19. You have to factor in, ensure that you're not creating new hazards as a result of that. So employers have a duty to take all reasonable precautions to protect workers from the risk of heat stress. For factories, there are additional requirements regarding ventilation and temperature under sections 128 and 129 of the Industrial Reg, linked in the presentation. And the employer, in consultation with Joint Health and Safety Committee, may wish to refer to the Ministry's Guide on Heat Stress. And again, the link is provided there. It's a great thing to have in place, even prior to the pandemic. You should have a heat stress program in place at your workplace, even if it isn't a hot work process, just with the heat. And it's always a good practice to have that in place. Next slide, please. So the Act makes it clear that employers have the greatest responsibility with respect to health and safety in the workplace. However, all parties have a responsibility for promoting health and safety in the workplace and to help the workplace be in compliance with the Act. So respective roles and responsibilities for all workplace parties are detailed in the Act, and this is the basis for the internal responsibility system. You know, I could tell you as an inspector, when I started with the ministry, you know, I would often have this discussion with workplace parties because, in my past working background, I worked in the automotive manufacturing sector. And so I've been on the other side of when the Ministry of Labor comes in. And I know there's this impression that, the Ministry of Labor is, this power, this government coming in. But, as I explained to workers and workplace parties, the real power is in the internal responsibility system, because an inspector going in is ensuring compliance with the Act and its regulation, but they're ensuring compliance to the minimum standard. That's the level of enforcement and level of power that they have. The internal responsibility system, on the other hand, your joint health and safety committees, health and safety representatives can make recommendations to employers and workplace parties that, if endorsed, can go above and beyond the minimum standard, which is, of course, the long-term goal here. The better the internal responsibility system, the better protection for workers. But what we enforce at the end of the day is the minimum standard. So the real power, in my mind, is the internal responsibility system. If we can go to the next slide, please. So just to cover some of the responsibilities, for the employer, must ensure that workers know about hazards and dangers by providing information, instruction, and supervision on how to work safely. Ensure supervisors know what is required to protect workers' health and safety on the job, to create workplace health and safety policies and procedures, to ensure everyone follows the law and the workplace health and safety policies and procedures, ensure workers wear and use the right protective equipment, and do everything reasonable in the circumstance to protect workers. Next slide, please. So workers have basically the three essential rights: the right to know about hazards in their work and get information, supervision, and instruction to protect their health and safety on the job. They have the right to participate in identifying and solving workplace health and safety problems, either through the health and safety representative or a worker member of the Joint Health and Safety Committee. And of course, the right to refuse work that they believe is dangerous to their health and safety or that of any other worker in the workplace. Workers should always raise any concerns to the supervisor, Joint Health and Safety Committee, and Health and Safety representative. So we do have our call center where anyone can call in a health and safety concern. But if you're a workplace party calling in a health and safety concerns, one of the questions you'll be asked is, have you brought it up in the workplace? So ideally, the first round is things are handled and addressed through the internal responsibility system. And when that cannot be resolved at a level, then it comes to the Ministry of Labor. Next slide, please. So of course, workers have responsibilities as well, reporting hazards in the workplace, working safely and following safe work practices, using the required personal protective equipment, and participating in the health and safety programs established for the workplace. Next slide. So when determining reasonable precautions for the protection of workers during the pandemic, employers should follow the guidance provided by the Public Health Ontario and the Ministry of Health. This includes encouraging workers to wash hands often with soap and water or alcohol-based hand sanitizer, sneeze and cough into a sleeve. If a tissue is used, discard it immediately and wash your hands. Avoid touching eyes, nose, or mouth. Avoid contact with people who are sick. Avoid high-touch areas where possible, or ensure hands are cleaned afterwards. And where possible, wear gloves when interacting with high-touch areas. Do not touch face with gloved hands, and take care when removing gloves, ensuring hands are washed after removing the gloves. Next slide. So the ministry also has, for employers, whether you're currently operating or planning for your workers to return to work, the guide will help you develop a plan to work safely. It will prepare you to put controls into place to make the workplace safer for everyone. So the safety plan template is provided in this document, as well resources to prevent COVID-19 in the workplace for sector-specific information, examples of control that apply to your workplace specifically. What I've found through the pandemic as we've gone through is, we tend to see an uptick in complaints from sectors as they start up again. And if I have one piece of advice, it is just flood your workers with information before they even set foot in your workplace to restart, so that they're not just stepping in that first day with all sorts of apprehension. Give them as much information as you can in advance about the steps that you've taken to prevent their health and safety. And I think you'll be on a better footing moving forward. We can go to the next slide. So we have a number of printable posters available, how to self-isolate, how to self-monitor, cleaning and disinfecting for public settings, and Public Health Ontario's how to hand wash poster, again, available through the links in the presentation. We also have a number of online resources. For the Ministry's Guide to the Occupational Health and Safety Act. You also may wish to contact one of the health and safety partners for assistance if need be. We also have a number of resources to prevent COVID-19 in the workplace, including manufacturing health and safety during COVID-19. And please check the Ministry of Health COVID-19 website regularly for updates, frequently asked questions, and other information related to COVID-19. Particularly the Ministry of Health and Ministry of Labor websites are great resources. You know, as this thing continues to evolve, the pandemic continues to evolve, and we continue to gather information, a lot of the precautions we have are their point in time, right? So, you know, if you looked at it today and set up all your programs and policies and away you went and never went back to these documents, you may not be aware of things changing. So what's in place today, you know, a month from now, it could be something different. So very important to stay in tune with that information. Next slide. From what I understand, the questions are going to be held until the end of the Q&A part of the presentation. So that brings me to the end of my piece, and I will now hand it over to Kim. Thank you.
Thank you, Ron. Good morning, everyone. Good afternoon in a couple minutes. I appreciate the opportunity to be able to speak to you today. I'll just let the slide presentation be shown in the view for the full screen. Would be wonderful, thank you. Okay, great. My name is Kim Litchfield. I am a regional manager for the West region, and West is defined for WSIB as Niagara, down through Hamilton, London, as far as Windsor. So that is the area that I look after, and my focus is the Health and Safety Excellence Program. So again, thank you for the opportunity to join and providing it to speak to you today. I'll be sharing you some details with the new Health and Safety Excellence Program. I understand that some of you may be from outside of Ontario. So just for a bit of clarity, this is an Ontario-based program. And however, if you're as a business have an account with the WSIB in Ontario and you are registered, then the program can still be an advantage to you as well. Following on the comments that Ron made, COVID-19 pandemic has created a great deal of uncertainty. We're all aware, and it's really changed the way we do business. Well, none of us are really sure what that's going to look like in the foreseeable future. We do know that every business in Ontario must ensure to be diligent to keep the health and safety of their employees, the public, the customers, and of course, limiting the spread of COVID-19. So the Health and Safety Excellence Program, which I will likely just refer to as excellent as I go through the presentation, is really flexible and designed to support businesses during this time. And I will show you also how we are focused on helping business stay pandemic ready and safe as well as the province reopens. So whether you're just getting started by responding to COVID or focusing on opening your business, WSIB's program, we really are attempting to provide you with a clear roadmap on how to improve health and safety in your workplace. And by doing that, earning some financial incentives and recognition as a result of your efforts. So there's a number of different benefits to the program, which I will go into a bit more detail, but just very quickly, we do have some pandemic readiness materials. We offer, the program is designed where you are working with a provider who's experienced in health and safety, and that is their focus of their business. So you receive support and guidance from a provider of your choice. You will receive rebates if you're successfully completing your action plan, opportunity to show in terms of recognition to your employees as well as your supply network or any of those pieces in your commitment to health and safety. So I really just want to explain a little bit how the program works and how you can join the number of companies. We currently have over 1,600 employers registered with the program, and the program's new. So I think that's a good start, and I'll go through the same information now. So if I could get the next slide, please. Okay. So for the agenda, I identified that the program can assist you with COVID-19. I'll go through the details of the program itself, how it works. It's fairly straightforward. Some of the next steps that you can take, and then just a quick slide on resources that can be shared as well. So moving on to the next slide. So in terms of health and safety challenges, just to start the conversation to give us some context, we hear that employers struggle with health and safety, and the top 4 reasons, and you may be experiencing some of this as well, is one of the first being health and safety practices and programs that meet the minimum requirements. We know the Occupational Health and Safety Act contains a significant amount of information. There's a lot of things to cover and a lot of information to know. It can be daunting in some aspects. Even health and safety professionals, have to really look at the act. So that's one of the challenges, but it can become overcome with some assistance. Of course, the second is cost and time. We do hear that a lot. I think that's one that I've heard in my career as a safety professional the most. It's not that people wish their employees to be hurt or be unsafe, but there needs to be a balance in running the business and having your programs in place. So that is always on the table in terms of a challenge. The next piece is tools and knowledge. Typically what we find are there's often a lot of resources out there on a particular topic, but it's a matter of trying to find what works for you, because there's various elements in your business that may or may not work for those types of resources. So based on the sector that you're in, the size of the business, whether you're operating internationally as an example. So those tools and resources can be hard to find, and you need to have access to them as soon as you can, as opposed to spending time to do that. So that is a challenge, particularly for larger businesses and those who operate across a geographic region. And the last challenge we see is getting employees involved. And when I say that, I mean, typically we think of the health and safety committees. Getting employees involved and understanding what their role is important. And this is a communication piece that can be a challenge, because sometimes things change. And this environment has definitely created some different scenarios on how to get the employees involved. And to the point earlier, it's communication in advance as much as possible is key. Okay, so next slide. So the goal of the program is to help you build a sustainable health and safety program. So a comprehensive health and safety program or management systems. So this top icon mentions 36 health and safety topics. I will go through the topics in general, but I don't want you to feel like the first reaction may be, oh, this is 36 topics. Wow, that's a lot. It's really not. We've divided the topics into levels that will help you achieve at a pace that works for you. The program is also designed in a sense that if you've already accomplished some of these topics and have programs in place, there's no reason to do that again. So you might have programs that are working very well. The program does not want you to necessarily to redesign them in any shape and form. What we're asking to do is focus on new workplace and safety initiatives for your organization. So you may already find that some of those topics are covered off in your business. And this is a way to look at what you might be doing new and in the future. And there is an assessment piece in which I will speak about a little bit later, but the assessment piece to help you select which topics would be most appropriate. And this assessment, once you are working with a provider, gives you some guidance on what topics would be most relevant to you to work on over a period of time within, say, the 12 months, first action plan, and moving forward. So there is guidance to help from that perspective. Recognition to show your employees, customers, investors your commitment to health and safety. We do have a badge system, so as soon as you join, there's an opportunity to demonstrate to the public that's the case. I mentioned pandemic readiness materials. I'll go over those as well. We have a brand new recovery roadmap, which I have a couple slides on that'll explain how you can, when you're resuming your operations, some of the pieces to consider. Of course, rebates on premiums are important. I'll give you a bit of a sense on, you know, what that might look like as an example. Of course, it'd be specific to your business, but I'll walk through one example so you'll have an understanding of what that scope looks like. The other piece to the program that's new is it has some flexibility. There's a enrollment can be at any time of the year. If any of you have been in safety groups in the past, you might recall that you sign up in the fall, you start off in January, and you really had to stay along that timeline. This program is designed that you can join at any point when the provider is working in that approach. So that allows that to happen as well. So next slide. I just want to go quickly in the next over the Government Ontario safety guidelines for COVID-19. So if I can move you to the next slide, you will see that the government has released new safety guidelines to protect the workers. I'm hoping that you've had an opportunity to look at them. And of course, the general public as well as customers as we reopen. These guidelines will make you are available for different industries. So for specifically, as an example, manufacturing, which is which is a sector that the Workplace Safety and Prevention System works for. They have produced a guide and a resource and toolkit to help manufacturing environments. So it's very specific to manufacturing. So those resources, I would encourage you to go through to the guidelines and look at what are these types, all this information in the sector that you are in. And I understand most of it's manufacturing. So these resources will give you different examples of controls. Curbside pickup, of course, is more retail, but there's some this type of control measure in a manufacturing environment. There's guidelines along that. So workplace safety prevention services, and we will make sure that you get the link to, you have the link in the presentation. And if there's any questions around the guide, I can point with Shelley and Mike's help, I can provide you with that as well. So next slide. So here's the health and safety program levels. I just mentioned before that there are 36 topics. The program is divided into 3 areas. So we have a foundation, getting started. We have an intermediate where you build the program, and we have advanced. So if you look at this slide, you'll see at the bottom right side, you're moving from awareness. So you might have a basic understanding of the health and safety system, and you'll be joining where you're starting out. This is typically more our small businesses. As you move through the program, you have the opportunity to become accredited to the CPO. So it is tied to the CPO accreditation process. So that's the Chief Prevention Officer in Ontario. There is a new program. I won't speak to it today, but this program aligns. And once you've completed that, you have the programs in place that would allow you to apply for accreditation. So you can see there's a bit of, there's variation here. And what we're finding is that if we look at the assessment results from employers who have registered, we're getting a real mix. So we are seeing people or employers who have, and companies who have, intermediate. They have some topics in place, but the focus of what they need to be is there. We also have some newer employers, and we even have a lot of advanced employers as well who have a managed system, and they have some new initiatives to work on. So that's important. It's designed to help you navigate a path through the program itself. So these, each level really does represent a milestone of achievement. And again, you may choose to work through one topic, or you may choose to work through more than. There's a limit of 5 topics per year. in a 12-month period. So it does take a little bit of time to go through, but again, keep in mind that you probably have some of these pieces in place. So it allows you to choose where on the maturity scale, if you'd like to refer to the program in that way, where you fit through the assessment. Next slide. Okay, I mentioned when we first started that we have a new recovery roadmap. So what we've tried to do is build a tool that will help you identify some of the steps and some of the questions to be asking, and through the reopening type of scenario, of which some of you may already still be open, but I think some of these pieces are important as well. We do have distinct pathways. We have one for small business, because there are some pieces to consider for those small businesses, medium and large businesses, and then of course we have a pathway for any size of businesses with an existing program and they're retooling or changing their operations. So the pathway will include some key health and safety considerations and suggest program topics. So if I can move to the next slide, I've got an example here for medium and large businesses. And you'll see that there's 4 steps. The steps are based on a plan, do, check, act type of approach. So first, of course, you identify the hazards and then control the risks. Number 2 is resume or maintain your operations. The third step is build resiliency and sustainability. And then, of course, evaluation. So if I look at the different pieces that are in the pathway, and I won't go through them all, but just to give you a bit of a sense. So for step 1, as an example, you will find that the tool provides you with a series of questions and fairly straightforward. And then of course the topics that go by. So one of the questions that's in the first one for medium and large business is, do you have a process to identify and report COVID-19 and other hazards? So do you have a process that's written and communicated to your employees? So we will identify the topics that I mentioned, one of those 36 in the program that would assist you if you do not have that type of process in place. Through recognition of hazards is one example, or a risk assessment is another. Then if I if we have a medium or large size business moving through to step 2 with resuming and maintaining operations, questions that are really critical at this point is, have you implemented a control plan to address the potential hazards? And does your plan include communicating all updated safety protocols and provide appropriate training for your employees and contractors? And then again, we identify some of those hazards or topics that those answers will tie into if you need to move forward and don't have those pieces in place. The step 3 is in terms of proactively building some resiliency and sustainability in your business. So some of the questions that you'll see in our tool, do you regularly assess employee physical and mental well-being, as an example? We know at this particular time, we're all very in tune to the well-being of our staff, and that's important. And there's a number of topics within the program that will help. Even something like return to work is a way to demonstrate that. And the last step in our roadmap is evaluation. So this is the effectiveness of your health and safety program, and to ensure that you have some continuous improvement. So, again, a fairly straightforward question: have you evaluated the hazard controls in your workplace for effectiveness? And we tie that back to the topics and some of the pieces that you need to have in place to build your program as you move out. So if I can move to the next slide. One thing I did want to identify is we have employers. These are 5 topics. We've gone through all the 36 topics, and we've identified what are the most common topics within the program that would allow an employer who's working on health and safety protocols or procedures or implementation related to COVID specifically, that would fit in. So for example, if you had chosen the topic of risk assessment, in addition to risk assessing or assessing other hazards in your workplace, of course, what you're doing for COVID-19 could be part of that as well. So The one thing to keep in mind, I did mention that the program's based on new initiatives, but we do recognize that COVID-19 sort of caught us all off guard, and there's been a lot of activity since March, some as early as February and January. So any information before you go to the program element is acceptable for COVID-19 just because of the circumstances. Another piece, of course, is control of hazards. So if you decide that COVID-19 and pandemics is a hazard in itself, you can put together policies and procedures under those topics and address that, and it will apply to that particular topic in your action plan. Of course, emergency prevention and preparedness. If you're building your emergency prevention and preparedness plan, and you're also including a pandemic readiness, that piece helps you as well. And that leads into emergency response. And then, as I mentioned earlier, the workplace health promotion. So if you're building out a health promotion well-being piece as part of your safety program, where you're trying to empower your staff and support mental health, and you have an opportunity to introduce the COVID piece and continue on with that type of support, you'll see a linkage there as well. So I'm going to walk through how the program works and hopefully find some clarity, and of course answer questions later. So if we go to the next slide, it's again fairly straightforward. We've got 4 steps. So we want you to join. There's a sign up. So there's a commitment. There's no charge to join. That's important from WSIB's perspective. There are providers, but I'll get into that in a bit. Then the second piece is to focus on developing your program. So those topics that you've chosen through your assessment. The third step is to demonstrate. And the fourth step is to achieve. So if I can move into the next slide, I'll just walk you through the pieces that are critical for each step. So for step 1, if you're interested in joining, we do have a provider model. So we would encourage you to look at the different approved providers. They are on our website. They do identify what types of services and solutions that they have. There's a variety. Some offer one-on-one support. Others have sort of a group approach, online, well, not so much in person anymore, but there's different ways that the providers are providing services to assist with the topic development. They do charge a bit. Typically, we've seen that the fees are ranging from $400 to $1,200, but I think you'll see when we get to the rebate piece, that really is a fraction of what your rebate can be. So that's the piece in terms of the financial commitment. You're working with the provider, you're not WSIB from that perspective, but with the provider under their model. We do have a list of providers on our website, as well as a series of questions that you should be asking to pick the right provider. Currently, we have 26. We are expanding that portfolio of providers. So there's a lot of choice out there. It includes health and safety associations, as well as private consulting health and safety firms. So these are all health and safety experts. I mentioned that you would complete the online health and safety assessment. So this will walk you through some questions specific to your program. It will identify what topics based on the assessment results and the information that you've inputted into it, the topics that are recommended. And the next part of joining is to select 1 to 5 topics. We have identified that 5 topics are the most to do in 1 year, just based on the amount of work that's there. So if anybody's been in safety groups before, you had your mandatory topic and you were working on a number of them, so you didn't have as much flexibility here. So you can just select 1 topic if you wish. And then again, the guidance of the provider to help you understand, because they'll have information or will be asking you questions about your business. So in addition to having the health and safety assessment results, as well as the business results, or conversation with your provider about where you're at in your program and what your business's goals are, then you will come up with the topics that are most appropriate for yourselves. The second step, if we can move into develop. Okay, I think I might have covered this. So with the guidance from your provider, you complete the topics you selected. So again, this is, I have my action plan. An action plan is basically the topics that I'm going to address, how I'm going to address them, and when I'm going to complete them. And the step 2 is basically to go through and develop each of those topics that you have selected, again, with the guidance from your provider and the service delivery model that you have chosen with them. Moving on to the next step is demonstrate. So once you've completed all the topics in your action plan, we are asking that, well, we're asking, part of the program approach is that all your evidence will be submitted to WSIB validation. And what we're looking for here, I said all, I should clarify, we're looking for evidence to demonstrate that you have implemented the topics in your workplace. So the WSIB will look to understand there is a digital platform, an online platform that allows for easy submission. We're in a point where we're receiving those types of submissions now. We're seeing some really creative evidence that the topics are being implemented. Where, you know, an example might be a video with your employees talking about their awareness of what the hazards are, and say senior management's commitment. We're just really asking employers to tell us a bit of a story of where you were at with respect to that particular topic and how you've improved that, and most importantly, how you can demonstrate that. So that piece, what we do is we have what we call a desk review from a WSIB validator, and their job is to read the story and understand and link the evidence to all the pieces that you've identified that you've done. We're not asking, safety groups, I believe in the past, has asked for a lot of policies and procedure, and a significant amount of work had to be submitted. This is not as intense from that perspective. We're looking for key pieces that demonstrate the living and breathing of the program topics that you have. Now, we do understand that there may be times where it might be a little bit unclear. So if our validators review the evidence and they've determined the topic, the validator may say, okay, there's gaps here. You have 60 calendar days to address them. So this is the flexibility. You have to keep in mind that our goal is to have 100% of the employees register, complete the topics, and receive their rebates. So this is where we're at. That's why something like the 60 days is helpful. And it doesn't tie you into getting it all right and perfect right off the gate, and still being successful in the program. So if I can move to, achieve. Sorry, I'll just go there. The last step is achieve, and this is where you have the rewards from the work that you've done. You have to successfully complete the topic, I said it a few times, through the validation process to be eligible for the rebate. Just a little bit of information, and this is on our program details. You have to be in compliance with the Workplace Safety Insurance Act. Of course, I mentioned you have to be registered with the Ontario WSIB. Your accounts must be balanced. There's no outstanding owing. If you're going to receive financial rebates, that makes sense. It's for Schedule I employers. I don't know which is the majority of employers. Government agencies might be Schedule II, and there's a different a model for the Schedule II, which I won't go into now. So that's what we're asking in terms of achieving. So you just need to have an account in good standing with the WSIB. So to the next slide. I'll move mine, so we'll just jump through this introduction transition slide and move on to the compass slide next. Okay, so I just wanted to bring in compass into the conversation because it will lead into understanding the rebate piece. Really at the end of the day, we want everybody to be safer and not being hurt, and we want to achieve better outcomes. So our program does align with the WSIB's new premium rate setting model, which you are probably all aware of. in which your business experience is. So the program is aligned with that. We encourage you to use Compass. It's the tool available on our website to access data, to find out where you can improve and find information to calculate your rebate. So Compass is the public-facing document that allows you to see your claims, the injury status and your claims experience. There's also individual accounts where you can see that type of information on your premium rates. So we're trying to leverage, basically we're trying to leverage the data in new ways through the health and safety program and safety performance in Ontario. So you will find Compass on the website, WSIB website. It's very straightforward. It's right up front on the main page. That's a resource that's available to you if you want to find out some of the information that's needed to calculate your rebate. So we'll move into the rebate piece, which is important. Sorry, of course my phone goes off when I'm speaking. Okay, so this looks like a really busy slide, and I will walk through it quickly, but keep in mind that we have consultants that can give you all the details of your particular account and for your business. This is just an example to give you a sense of what the scale could be. Okay, so there's three pieces in terms of the rebate calculation. One is your prior year's premiums. So that is the first number that you need to have. The second piece is around predictability. So that's the predictability of being able to prevent and manage and control injuries and illnesses. And it depends on a number of factors. So if you're less than 20%, which means you have less control over it, you would receive a higher percentage of the rebate at 2%. It's greater than 20%, you're lower. So in terms of predictability. And then of course, the last factor is the number of topics. So the example that you see here, let's assume a business has premium rates of $200,000 a year. These numbers are basically used in this example to make the math easy. You have less control over the injury and illness piece in terms of predictability. So you will receive a 2% per topic. You've been diligent and completed all 5 topics in your action plan, you would receive a $20,000 rebate. So those numbers are quite significant. The other element to the rebate is small business. I don't have an example here, but we do recognize that small businesses, if you were to use these type of calculations, it would be, wouldn't be worth their time necessarily. So we do have a minimum and a maximum, a minimum of $1,000 per topic, up to 75% of an annual premiums, and this really helps a small business. And then it is mentioned that we have a maximum of $50,000 per topic, which is significant in itself. So going on to the next slide, this is the public recognition piece. When you join, you'll have access to a member badge. You'll have the ability to add that to your website, social media, letterhead if we're still using that. It just is something to say, I've made a commitment, I am a member. And there will also be a performance badges. They'll be released closer to the fall, but they'll identify what level you're in as well. So those will, as you go through the program and move from one foundation element to the next, your badges will change. The other piece that's on there is, is the Small Business Awards. We put this in there as just a bit of a plug that there is a Small Business Leadership Award that businesses can apply for, and it's the same concept in terms of public recognition. So we do have some small business winners who have joined the program, so they'd have the ability to use those badges that they have accomplished for sure. Okay, so the next, that covers off the badges. I just want to bring into the conversation quickly about measuring change in culture. The culture survey it's really a snapshot of your employees. perception of health and safety. On the right, you'll see a couple questions. They're straightforward. It's asking if your employees are feeling comfortable. Are they receiving the information? And it gives you a sense of what the measurement and of the culture is. So basically, what is the culture and climate in terms of health and safety as a baseline? So how safely they feel. And that's through an anonymous survey that is facilitated through our platform and gives you the information back. So it's optional part of the program, but we've found that most of those who are joining the program are going through the culture survey. It's an added tool that's available to you. So moving to next steps, because I recognize I need to pass this over to Melissa quickly. The last two slides, I would say that if you'd like more information and you're interested and would like some assistance in calculating your rebate, we do have a health and safety excellence email. They will refer you to a consultant. We have consultants across the province who are there to assist employers one-on-one to make that decision. We hope that you do and you're interested in joining, and you will select an approved provider and register to the program, and then obviously complete that and receive your achievements in terms of rebates and badges. And then if the last slide I believe I have here is just a list of links for some of the program tools that are there. So we have guidelines as well as frequently asked questions. We have information. Our roadmap will be on our website early next week. You're actually the first group to see that. So just give it a couple days, it'll be there. And then if I jump 2 slides ahead, you will see that we have provided you with some very specific COVID-19 supports for employers. So some ministry guidance documents, updates from WSIB, an adjudication document, information on the financial relief package, and our online services. So at this point, I understand questions again are at the end. I will pass it on to Melissa to discuss the COVID-19 reporting. Thank you.
Great, thank you so much, Kim. I think my video is on. I hope so. I'll just briefly go over this. I'm going to cover very quickly at a high level our COVID-19 response at the WSIB. One of the links that Kim had earlier, if you go into WSIB.ca, you will see right on the front page links to our COVID-19 update page. All of the most up-to-date information is there. And I'm going to talk about 2 things in specific. One that's outlined on this slide, and the other one is you may just be interested in how many COVID-19 claims we've actually received. So there is a link on, if you go into the COVID-19 information page, it'll say claim stats, and this will take you there. It's updated every week. So as of the end of last week or Monday this week, there was 3,491 allowed claims, 801 denied, still 524 pending, and then 2,713 exposures reported. So, and it gives you also the classes or the areas where we're seeing the most claims by number. So of course, nursing and residential care facilities right now is where most of the claims are. And then beyond that is hospitals, Schedule II employers, agriculture, and ambulatory healthcare. So some of that makes sense for our experience thus far with COVID-19. I think one of the points that Ron made is that this is an evolving situation, and what is happening today may not be what it looks like in a week or a month or who knows, some indefinite period of time from now. So let's talk about COVID-19 claims. I think Ron and Kim have spoken a lot about prevention and health and safety in the workplace. And of course, those are key to making sure claims don't happen. But if you do have a claim that happens, I think it's important to think about, so how do we recognize that it's work related? Because we know that COVID-19 can be caught any number of places. You can catch it in public. or you can have an outbreak in your workplace. You know, especially workplaces. I mean, of course, early on, we had a lot of discussion around COVID-19 outbreaks at long-term care facilities and residential homes, congregate living settings. Currently, there's a lot of discussion around migrant farm worker claims, again, perhaps due to the fact of, you know, they tend to live in congregate living settings, work closely together. We've heard in the news about things like meatpacking plants or other manufacturing facilities where people might be closer at hand to each other. So, you know, because we know it transfers person to person, someone brought it there and then they were in contact with other people. So that, you know, it didn't just happen there, but you can prevent as much as you can. And then in order for us to allow a claim for COVID-19 as having been a workplace injury or illness, we have to look at two criteria. One, that the person had a greater risk of contracting it in the workplace than they did in somewhere else in their life. So all claims are contacted by either a case manager or a nurse consultant to have some conversation around where someone thinks they may have contracted it. And this is not contract tracing from, you know, what you think of as a public health standpoint. It's just trying to understand, you know, do they also take public transit? Do they have someone in their home that works in a public facing job? Someone who's maybe works in a higher risk setting, things like that. If as the employer, you're filling out the Form 7 to report the workplace injury or illness, you may be thinking, well, I don't know where they caught it, but they're telling me they think they got it at work, and that's fine. Complete the Form 7 and give us what information you do know, and we will figure it out. I'm trying to think of the other point I was trying to establish there, but in any case, you know, if you find that you have someone positive in the workplace and you may have had some other employees that have been in contact with them, and you have to tell them that, and they're going to go home and isolate. While they're going home and isolating, if they're not having symptoms, you don't know if they're going to actually come down with the illness. You would not have to complete a Form 7 at that point, because the Form 7 only happens once you have a workplace injury or illness. So if they do report to you a few days later, they have become symptomatic, they've gone to get a test, then that's when you would fill out the Form 7. So we will look at then, you know, do they have the actual diagnosis? Because we know there's, you know, tens of thousands of people being tested daily, and only, you know, a small amount of them are positive. So we need to have the diagnosis through testing. Earlier on in this process, when testing was not as widely available, not everybody could get it, especially if they only had mild symptoms. We were looking at just, you know, whether the symptomology was consistent with that which we knew to expect from public health. But now that testing is widely available, we will need to see evidence that there was a positive test. And just for context, and you know, whether this interests you, a lot of the denials, because I spoke to you about the claim set, there are some claims that are denied. The greatest many of those claims that are denied are because the person didn't end up being diagnosed with COVID-19. So they had a negative test result. So just helps contextualize where we're at. And again, I've often had the question, well, you know, I don't know if the person did get it here. Again, ask the worker a question, you know, do they think they got it from work? Are they planning to file a claim? And if the answer is yes, complete the Form 7. But again, give us what information you know, and we will go from there. Our website is updated regularly with Q&A and things like that. You know, we're running into a lot of unique circumstances with respect to COVID-19 and how we have to pivot and transition our work during this period. So there's a lot of different questions that people have. And there is quite a large amount of Q&A and information there. So always go to the website and look at that page, because you'll get the most up-to-date information. What I will mention as well is with respect to financial relief. So currently, premiums are deferred to August 31st. So if you had premiums due, I from whenever the announcement was made. You do not have to pay until August 31st without penalty. So that's good. And the cost of COVID claims, like claims that are paid with that diagnosis, will come in at the schedule level. So what that means is, you have your account and you are in a class, and then there's the whole Schedule 1. So when we think about what Schedule 1 is a group of 300,000 employers that are divided into 34 different classes. So if we think about it, the cost of these claims are going to be spread over all of those 34 classes and all of those 300,000 employers. Because we know if this were to come down to, attributing to your account and your claims experience individually, some employers would have, a very large number, and some would have none at all. And this is, something we're all in this together, and we're just trying to figure out the fairest way to cover the cost of these claims. And so that no one person, no one company, no one class is inadvertently disadvantaged, that's the best way to do it. I'm not sure what else to go into right now. I'm just, the information is here. If you have questions, I will, of course, gladly take them. We have, there's lots of unique situations that we've been encountering and lots of people coming up with sort of unique questions. So I'd love to hear what your questions or thoughts are. I'll just throw one other brief thing out there around working from home, because again, this is usually quite a large discussion point. I'm not sure if you're experiencing this in the kind of industry you're in, but for me, we were a completely in-office company, and now we're a completely work-from-home company. So, you have maybe previously not experienced having employees work from home and what that looks and feels like, but you may now have employees that are working from home, and you're concerned, what if they get injured at home while they're working? And there are cases that can be allowed for that, depending on what they were doing, how they got injured. Certainly if someone says, oh, at 9 o'clock at night, I was taking the laundry downstairs and fell, but it's my office, that's not going to be allowed. And I'm giving you a very clearly not allowed scenario. But if someone said, my computer setup is not, very ergonomic, and I'm using my mouse a lot more, and I'm finding, I use it with my right hand and I'm finding some pain in my right wrist, that's something that could be. So I ask you to give some consideration with employees that are working from home, if you can, if they are struggling with their ergonomic setup, maybe you can do some troubleshooting over a video call, see if there's different strategies, different best practices out there. I know my employer sends out a weekly email giving us some thoughts on, the right kind of chair and the right kind of setup, and, doing what you can do to still perform your best in this environment, knowing we all probably transition to working from home very quickly, and without sort of a lot of thinking about, do I have a desk or a chair, or what does that look or feel like? And I know as an employer, you may feel like you have a lot less control in the home office situation, and that may, be somewhat true, but work from home scenarios are not unique. At the board, we've been handling claims of people that work from home, or, think of salespeople who are on the road, work in their car or on the road regularly. So we're pretty experienced at dealing with those kinds of claims as well. We can always help you out with that. I'm going to leave it there. I'll go to questions.
Well, thank you, Melissa. It's just like, holy fire hose of information from the three of you. Thank you very, very much. And we do have, so we've got about 15 minutes for questions. So what I'm going to do is ask our panelists to put their cameras and microphones on. Mike Bilton, if you could put your camera and microphone on as well. And why don't we just dive right into questions? Mike, I think you've got one to start us off with.
Yeah, the first question is to Ron. Back in your early on in the presentation, you were circling around the inspections, and you had a line in there that was reactive type inspections and proactive type inspections. The question I have, and I think some people would ask the same question, is how do you prioritize or rank the proactive inspections? What's the criteria and the tip-off points that you are given to go out and do that? or even for the reactive type audits as well?
So our fieldwork activity, especially on the proactive side, is obviously for the last few months focused on COVID-19 and COVID-19 precautions. We've been paying particular attention to the reopening of businesses, as various businesses are authorized to reopen, and spending some of our time there proactively. And again, on the reactive side, as new businesses open up, we tend to get complaints from those new businesses. So that tends to drive some of our business as well.
Right.
But by far, our priority has been providing outreach and compliance support to these workplace parties. Topic-wise, as far as the COVID-19 precautions are concerned, we kind of tend to focus on a number of areas. One being information instruction of workers. So, whether you're doing that by safety talks, tailgates, shift meetings, emails, we're looking at that, the frequency of those, what sort of specific topics you're covering, signage in workplace, reporting practices for the workplace, return to work practices for the workplace. We're also looking at the joint health and safety or health and safety rep involved, physical distancing. What are you doing? What is the workplace doing in situations where that can't be maintained? Again, back to the hierarchy of controls. Looking at active and passive screening for people entering the workplaces, be they workers or customers or folks coming in to service the equipment.
Right.
Specific cleaning protocol, hand hygiene, as I mentioned, and also personal protective equipment, to make sure what is being used is based on an assessment and is appropriate for the task.
Right.
On the topic of inspections, Ron, you mentioned that 6,400 orders have been issued to date for 2020.
Yes.
Is there information available, much like Melissa mentioned, there's information available for WSIB to see what I believe this is what you said, that we can see what kinds of claims have been filed on WSIB, so we can see the trends or what kinds of claims. What are the trends in the orders? Is there, what is the most common order that's issued, for example? Do you know that?
I think most of I think that the majority of the complaints that we get, or complaints or / work refusals, have been related to workers feeling that the employer is not doing enough to protect them. Mm-hmm. And typically it has to do with screening, in particular workplaces where they're interacting with the public. And as we all know, there's no quality control when you're dealing with the public. Especially early on in the pandemic, we had a lot of incidents where they felt that the screening techniques weren't appropriate, or that customers coming in were lying and then coming in. And then as it progressed, people started to see more physical barriers. So then we had a lot of concerns that there wasn't barriers in particular workplaces, or the type of barrier wasn't appropriate. And thirdly was just training. We found in many instances that we're going out that there was actually quite good policies and practices established. However, where the ball was dropped was communicating that to the workplace parties. So, there's orders are one thing, but I mean, it's all about compliance support. There's a lot more, particularly with guidance information. Providing information to the workplace parties, having that discussion with the workplace parties, that has allowed some of these issues to be resolved in cases, at times, without an order having to be issued, just in consultation with the workplace parties.
Okay. Mike, do you want to handle the next question?
Yeah, I've got it right here, actually. So one of the questions that came in is, do the requirements of Regulation 851 for industry establishment also include AG greenhouse type operations in the regulation scope?
So you have to look at the definition of industrial establishment and the application of the regulation in that particular circumstance to determine if it applies. It's all case by case specific. you know, as we've learned in particular with the opening of legal grow-ops, there's a big difference in a place that simply grows and sells versus processing. You know, as various levels of processing involve creep into the process, there can be crossover.
Okay.
Right. Thank you.
I've got one here from someone who's clearly a quality professional. So I think maybe, Kim, this might be within your area of expertise. So it's a two-part question. Can you comment on the use of ISO 45001, the International Occupational Health and Safety Management System Standard? So can you comment on the use of ISO 45001 compliance and or third-party certification in meeting legislative system requirements? And could an organization attain the WSIB rebate and the Health and Safety Excellence Program recognition with the compliance or registration to ISO 45001?
Okay, that's a good question, and we do get that one. If you're already in compliance and have gone through the third-party assessment and have received that, my recommendation would be that you would move to the application for the accreditation from the Chief Prevention Officer at that point, because you have a full management system in place. And the accreditation in Ontario recognizes organizations that have gone through those international or even Canadian type of standards, and they've meet those and they've been audited and they have achieved that. Now, if you're in the process of going through the ISO piece, what you will find is that there is some ties back to the Health and Safety Excellence Program. You would have to make sure that all the pieces within a topic would be covered in the program that you're building under the ISO, as an example. But we have tried to make sure that the standards are being met. So you do have that option. So if you're working on roles and responsibilities, as an example, through your ISO process, then I would just recommend that if you apply that to your action plan for the excellence program, obviously you need to meet what's in the ISO standard, and then you would just double check and make sure that that's in the excellence and it covers all the topics off there. And of course you do have to submit the evidence to us separately. And we're not auditing like ISO does, as an example. So you do have the option to collect the rebate, assuming you're working on a new initiative and you cover off all the topics and submit your evidence as the program requires.
Okay.
I hope that answered the question, the three parts.
That's good news. Yeah. Oh, that was very good.
Yeah.
Mike, do you have a question?
Yeah, actually, I'd like to go back and talk about the inspection portion. I had a second part to the first question that I asked, and the question is, when it comes to broadcasting, when you're going to be going out and doing inspections on site visits, how much time do you typically give, and what is the broadcasting method? Is it a phone call, email, saying, hey, look, we'd like to come to your facility to check? How much time typically between the initial contact to the actual visit goes by?
So there's no requirement to provide notification prior to an inspection.
Mm-hmm.
Particularly on the proactive side, they are unannounced inspections. Now, again, these are not normal times per se with the whole COVID-19 pandemic. So inspectors do have the opportunity, if they choose, to call the workplace in advance, just for the purpose of ensuring that, for example, they're not in the middle of some sort of outbreak, right? Because at the end of the day, the inspector is a worker as well. We do provide notice in advance of initiatives that we'll do across the province focusing on a particular hazard, and that information is posted on our website in advance. But the typical proactive inspection is not announced. Same thing with the reactive. Typically they are unannounced. The inspector just shows up and meets with the workplace parties and proceeds to look at the health and safety concern.
Okay, thanks very much. I think a lot of the people out there are quite curious of how that whole scene was, how it plays out. So thanks for that. Shelley, I've got one here on deck. Do you want to go ahead and take the next one, or I've got one ready to go?
No, you go ahead.
Okay, this question is for Melissa. What should be done when someone who is working from home contracts COVID?
Well, I really think, if they've worked from home the whole time. So I think of myself as an example. Since March 16th, I've worked from home. And if I contracted, and I live by myself, not that you need to know that part, I suppose. But if I contracted it, I can't imagine a scenario in which it could be construed as work related, because I do go out to get groceries or do other, errands and things like that. And we do know it's in the community. So I think if you had someone that was working from home and it was sort of in the similar situation to what I expressed as my situation, I think that begets a conversation, like how do they think it's work related? I guess at the end of the day, if they insist that it's work related and they're going to file a claim, then I would say do the Form 7. And if you feel strongly that it shouldn't be a claim, note your objections and the reasons why you think it shouldn't. And that gives us a lot of information to go on in terms of the decision making with that claim. Mm-hmm. And because at the end of the day, if they're intent on doing that, they do want a decision from us, and we will give them that decision.
Right. Okay. Thanks very much. Shelley?
That's about it for our questions. So Mike, you want to take us out?
Yeah, absolutely. So first and foremost, thank you to all the panelists and to our facilitators. Carly, behind the scenes work, thank you. A big shout out to you for helping us put this together. Thanks to my colleague Shelley for all your hard work in helping put this together as well. Certainly a lot of content covered here, a lot of information through the presentations. I would recommend and suggest to those who have further questions and want to seek the appropriate answers that you reach out directly one-on-one. You can contact the CAM office or Automate Canada office to get in contact directly with the panelists here. Reach out to Shelley or myself. We'll try and make the connection as quickly as possible. Boy, like I said, lots of commentary, everything from rebate calculations all the way down to how the inspections are actually performed and how quickly they're performed. A lot of great stuff here. So with that, if there's no more questions, with the interest of time being at hand, thank you again, everyone, for attending, and have a pleasant day. Thank you.
Thanks, everyone.
Thank you.
Join us for our next webinar on July 13th. It's going to be a focused discussion of economic forecasting from RBC Capital Markets. Thanks to someone here locally in Windsor, Essex, Jason Smith. So we'll see you then.